I thought I'd kind of address the question of what these new weight loss medications might do for the prevalence of cancer in the future. I think it's well recognized, and certainly seeing it in my clinic every day. A lot of patients are coming in now on these new medications for weight loss. Just by way of background, of course, I think we all know obesity is a problem in the U.S. I didn't know the exact numbers, but I looked these up, and it's estimation is that 42% of adults in the U.S. have obesity, and there have been projections that number will be nearly 50% in just 6 years. And I guess there's a list of 13 different cancers that have been associated with obesity. And it's basically all the cancers of the GI tract, pretty much. And then several female cancers, breast, ovarian, and endometrial. And then a couple outliers of myeloma and meningioma. So those are kind of the 13 that have been related for sure to obesity. And of course, these new obesity medications fall into the category of what are called GLP-1 agonists, which stands for glucagon-like peptide 1. And then there's one of them, I think, that inhibits something called glucose-dependent insulinotropic polypeptide as well. That's the tirzepatide or Mounjaro. So there was a recent poll out that suggested that 6% of American adults are taking a weight loss medication currently, and that 12% have at some point taken them in their lifetime so far. And I tell you, I wouldn't be surprised if that number increases as doctors get more comfortable prescribing these, and sort of more and more people see benefit in terms of weight loss. I can certainly see a lot of benefit in a number of my patients in achieving weight loss. And these drugs have a number of other benefits, of course. They're also approved for treatment of diabetes. And just I've noticed in the journals recently that there are reports of improvement in some of the other endpoints related to obesity, that is steatohepatitis or fatty liver and fibrosis. There's reports now that may be improving with some of these medications, and also sleep apnea. We all see, I see in my clinic all the time people with secondary polycythemia that I wind up just diagnosing them with obstructive sleep apnea, and that's a really tough disease to treat. And you can't help but wonder, well, gosh, if you could really help people lose weight, would that help treat their sleep apnea? And sure enough, now reports are coming out that these drugs may help improve the severity of obstructive sleep apnea as well.